The kidneys play a crucial role in filtering waste and balancing bodily functions, but certain medications could jeopardize their health. Every day, millions of people take common drugs, often unaware of the potential harm they can cause to kidney function over time. In this video, we'll explore 7 widely used medications that may put your kidneys at risk, as well as offer tips on how to safeguard your health. But first, let's dive into how medications can affect your kidneys. How medications affect kidney health. The kidneys are remarkable organs, performing vital tasks like filtering toxins from the blood, regulating fluid balance, and controlling blood pressure. These functions are essential for overall health, and the kidneys play a key role in maintaining the body's internal balance. They help remove waste, excess water, and toxins, and help regulate electrolytes, such as sodium and potassium, which are crucial for the body's normal function. When the kidneys are working efficiently, they ensure that the body's internal environment remains stable. However, medications can have a profound effect on kidney health. Many drugs, whether prescribed, over the counter, or recreational, can put a strain on the kidneys and affect their function. Some medications reduce blood flow to the kidneys, making it more difficult for them to filter waste. Others can cause inflammation in the kidney tissue, leading to damage over time. In some cases, drugs may lead to the buildup of toxic substances in the kidneys, causing further harm. The tricky part is that kidney damage often develops gradually, and early signs may be subtle or undetectable. The kidneys are highly adaptive and can continue to perform their essential functions even when they are damaged, which is why kidney issues often go unnoticed until they are severe. This is why it's so important to understand how medications can impact kidney health and take steps to protect them. Now that we have an understanding of how medications can affect the kidneys, let's take a closer look at 7 common medications that may pose a risk to kidney health. Non-steroidal anti-inflammatory drugs pain relief at a cost. Non-steroidal anti-inflammatory drugs, NSAIDs, including commonly used medications like ibuprofen, naproxen, and aspirin, are frequently used to alleviate pain and reduce inflammation. These over-the-counter and prescription medications are a go-to solution for conditions such as headaches, muscle pain, arthritis, and even mild fevers. While effective for managing pain, NSAIDs come with hidden risks, particularly when used long-term or in high doses. One of the primary ways NSAIDs affect kidney health is by reducing blood flow to the kidneys. They do this by inhibiting enzymes that help regulate the flow of blood to these vital organs. In addition, NSAIDs can increase inflammation within the kidneys, which can worsen damage over time. This combination of reduced blood flow and inflammation can strain the kidneys, leading to acute kidney injury or even chronic kidney disease in susceptible individuals. People at higher risk for NSAID-related kidney damage include those with chronic pain, arthritis, high blood pressure, or pre-existing kidney disease. Since kidney function can already be compromised in these individuals, regular use of NSAIDs can exacerbate their condition. For those in need of pain relief but concerned about the risks, safer alternatives like acetaminophen, under medical guidance, or physical therapy can be considered. These options may provide effective pain management without the harmful impact on kidney health. While NSAIDs are widely used for pain relief, another class of drugs, often prescribed for heart conditions, may also pose hidden dangers to kidney function. Let's explore those next. Proton pump inhibitors, PPIs, stomach relief, kidney risk. Proton pump inhibitors, PPIs, such as omeprazole, esomeprazole, and lansoprazole, are commonly prescribed to treat conditions like acid reflux, ulcers, and gastroesophageal reflux disease, GERD. These medications work by reducing stomach acid production, providing relief for those suffering from digestive discomfort. While PPIs can be effective in managing stomach-related issues, there is growing evidence linking their long-term use to serious kidney problems. Research has shown that prolonged use of PPIs is associated with an increased risk of chronic kidney disease, CKD, and kidney failure. One of the ways PPIs may harm the kidneys is by altering the kidney's ability to regulate fluid and electrolytes. They can also decrease magnesium levels in the body, which can lead to muscle cramps, fatigue, and in severe cases, irregular heart rhythms. Additionally, long-term PPI use can make individuals more susceptible to kidney infections, which can further compromise kidney health. Although PPIs are generally safe for short-term use, prolonged use should be carefully monitored. Safer alternatives may include lifestyle changes such as dietary modifications, weight management, and reducing stress, which can help manage acid reflux and other stomach conditions without relying on medication. Beyond digestive health, it's also important to consider that some common antibiotics can pose risks to kidney function. Let's take a closer look at those next. Certain antibiotics, fighting infection but straining the kidneys. Antibiotics are essential in treating infections, but certain types can be hard on the kidneys, causing kidney toxicity and damage. Common antibiotics like vancomycin, aminoglycosides such as gentamicin, and sulfa drugs have been linked to kidney damage, especially when used for prolonged periods or at high doses. These medications can harm the kidneys by damaging the cells responsible for filtering waste and toxins from the blood. The primary mechanism by which these antibiotics cause harm is by disrupting the function of the kidney's filtering cells, leading to a buildup of waste products in the body. Over time, this can result in acute kidney injury or even chronic kidney disease. In addition, the risk of kidney damage is higher in individuals who are elderly or those who have pre-existing kidney conditions, as their kidneys may already be compromised and less able to handle the strain of these drugs. For those who require antibiotics but are concerned about kidney health, safer alternatives are available. Narrow-spectrum antibiotics, which target specific bacteria rather than a broad range of pathogens, may be less damaging to the kidneys. It's also important to follow proper dosing instructions and seek doctor supervision, as careful monitoring can reduce the risk of kidney damage. Beyond antibiotics, it's important to consider that certain common blood pressure medications can also impact kidney function. Let's explore these next. ACE inhibitors and ARBs, a double-edged sword for blood pressure control. ACE inhibitors, angiotensin-converting enzyme inhibitors, and ARBs, angiotensin receptor blockers, are commonly prescribed for managing high blood pressure, heart failure, and certain kidney conditions. Medications like lisinopril and enalapril, ACE inhibitors, and losartan and valsartan ARBs help relax blood vessels, making it easier for the heart to pump blood and lowering blood pressure. While these drugs can be incredibly effective for cardiovascular health, they also come with a potential risk to kidney function, especially when used long-term. Both ACE inhibitors and ARBs can reduce the kidney's ability to filter blood properly, which can lead to a decline in kidney function over time. Additionally, these medications can increase potassium levels in the blood, a condition known as hyperkalemia. Elevated potassium can be dangerous and cause heart arrhythmias or other serious complications if not carefully managed. People who are at the greatest risk for kidney problems from ACE inhibitors and ARBs include those with pre-existing kidney disease or dehydration. Their kidneys are already under stress, and the effects of these drugs can exacerbate the situation. To minimize risks, regular monitoring of kidney function is essential, especially for individuals on these medications. Adjusting dosages and working closely with a healthcare provider can help manage blood pressure while protecting kidney health. While ACE inhibitors and ARBs are critical for controlling blood pressure, diabetes medications can also have unexpected effects on the kidneys. Let's explore how next. Diabetes medications, managing blood sugar, impacting kidney health. Diabetes medications, including commonly prescribed drugs like metformin and SGLT2 inhibitors such as canagliflozin, are essential for managing blood sugar levels in individuals with diabetes. These medications help control blood glucose by improving insulin sensitivity or promoting the excretion of glucose through urine. While they are effective for managing diabetes, they can also have unintended effects on kidney function, especially in certain individuals. Metformin, for example, is known to be excreted through the kidneys, and in rare cases, it can accumulate in the body if kidney function is impaired. This accumulation can lead to lactic acidosis, a serious and potentially life-threatening condition that occurs when lactic acid builds up in the bloodstream. Similarly, SGLT2 inhibitors, which work by promoting the removal of excess glucose through the urine, can also impact kidney function, particularly in patients with already compromised kidneys. Individuals at higher risk for kidney-related issues from diabetes medications include those with advanced kidney disease or dehydration. Dehydration can reduce kidney function and increase the likelihood of complications from these medications. To minimize risks, patients should ensure they stay well hydrated and have their kidney function monitored regularly. Doctors may also adjust medication dosages to ensure safe blood sugar management while protecting kidney health. Lastly, over-the-counter supplements, which are often perceived as harmless, can sometimes be more harmful than beneficial. Let's take a closer look at these next. Herbal supplements and over-the-counter medications, the hidden dangers. Herbal supplements and over-the-counter (OTC) medications are often seen as safe, natural alternatives to prescription drugs. However, many people don't realize that certain supplements can pose significant risks to kidney health. Common examples include creatine, St. John's wort, and various weight loss supplements. While these products may promise benefits like enhanced energy, mood improvement, or fat loss, they can contain unregulated toxins, heavy metals, or excess protein, all of which can strain the kidneys. For instance, creatine is often used by athletes and fitness enthusiasts to enhance performance, but when taken in excess, it can overload the kidneys, leading to kidney damage. Similarly, St. John's wort, which is sometimes used for mood regulation, can interfere with kidney function, especially when combined with other medications. Certain weight loss supplements may contain harmful ingredients that are not disclosed on the label, including compounds that put extra pressure on the kidneys. Those at greatest risk include athletes, fitness enthusiasts, and individuals who self medicate with herbal supplements without consulting a healthcare provider. Since the quality and safety of these supplements can vary widely, it's important to be cautious about what you're consuming. To protect kidney health, it's recommended to choose research backed supplements and consult with a doctor before starting any new supplement regimen. This ensures that the products you're using are safe and won't harm your kidneys. With so many potential risks, how can you protect your kidneys while managing your health? Let's explore some practical tips next.